morning to you all. I am Dr. K. Rajeshwari from Department of Public Health Dentistry, and today my topic of presentation is Introduction to Indices. What do you mean by an index? So, a person called Russell has defined index as it is defined as a numerical value. So, it is a number. What that number will tell us is it describes the relative status of a population. That is, it tells about the status of population. The status, it might be the dental caries status or the periodontal status or the oral hygiene status, and it goes on. So, it is a number which describes the status of a population. So, the number is graduated, that is, it always has an definite upper and lower limits. So, such as a 15 centimeter scale where the 0 mm is the lower limit and 15 centimeter is the upper limit. So, similar way our index also is graduated in such a manner that it is having a definite upper and lower limit. So, how it is designed? Always the index is designed in such a way that it will permit and facilitate comparison. We can compare to whom? With the other population, but the other population also has to be classified with the same criteria and methods. So, what is the definition of an index? It is a numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, and which is designed in such a way that we can compare with other population, but both the population has to be classified in a same criteria and methods. So this is the definition of indices. And for any index, there is an ideal requisites that has to be fulfilled by the index. The first is clarity, simplicity and objectivity. Next is validity. Third one is reliability or reproducibility. Quantifiability, sensitivity and acceptability is the ideal requisites of an index. So in the next slides we will see about what it means, each in requisite what it means. So coming to clarity, simplicity and objectivity. So any index we are using should be easy to apply on population, and while applying on the population, time should not be wasted during the examination, and also it should not use any expensive equipments because it is done on a larger basis. The cost effectiveness also should be seen. So it should be simple and time should not be lost during the examination, and no expensive equipment should be used. What is objectivity is the criteria for the index should be clear and it should be unambiguous with mutual categories. What is validity is what is the purpose of the index it has been framed. So it has to measure that alone. So what it is intended to measure, it has to measure. So there are two components of validity. One is sensitivity and the other is specificity. What is sensitivity is ability of the index to detect the condition when it is present. Suppose if you are examining dental caries status, so sensitivity is whether caries is present in the tooth or not, it has to measure. What is specificity is ability of the index to detect the condition when it is absent. So whether caries is present, that means sensitivity, and if it is absent the specificity should be examined by the index. What is reliability is the index should measure consistently at different times and at different conditions. Reliability is otherwise called as reproducibility. Suppose if two examiners are examining in the same patient for dental caries, means both of them should give the same result. That is, for example, if one person is saying that caries is present in 3/6, means the other also should say that caries is there in the 3/6 by using the criteria for the index. Then the reproducibility is there among the examiners. That is called inter-examiner. If two persons are examining, then it is called as inter-examiner reliability. And intra-examiner means same examiner, if it is repeating the index, then on both the times he or she has to say that caries is there in the teeth, both in 3/6, and in the next time if he is examining, then he or she has to say that 3/6 is caries is present. So that is intra-examiner reliability. What is quantifiability is the index should be applicable for statistical analysis, so that the results what we can get, we can extrapolate to the whole population, and final inference we can come to when it is applicable for statistical analysis. What is sensitivity is? Sensitivity for the indices, even small shifts in the disease pattern, it should be able to detect. Suppose if there is mild, moderate or severe gingivitis is present, the index should able to assess even the minor shifts either in the good direction or as well as in positive direction or in the negative direction. What is acceptability? The final requisite of an index is acceptability. That is, it should be safe, or it should not cause pain, and it should not cause demeaning to the subject, whomever we are applying the index. So these are all the ideal requisites of an index. So it should be clear, clarity, simplicity and objectivity should be there. Validity, what it is intended to measure, it has to measure, and reproducibility should be there. It should be applicable for statistical analysis, and sensitivity is even small shifts in the direction should be able to assess, and acceptability is it should not cause pain or demeaning to the patient. And coming to the classification of indices, based on various things we can classify indices based on direction, and based on extent of the teeth examined, and based on the entity what we are examining, and there are based on general categories classification has been given. Based on the direction, there are two types of indices. One is reversible index and the other is irreversible index. Reversible index measures the condition which can be changed. After doing any treatment, it can be changed. That is, it can either bring back to normal or to the Lexer score. Example for that is gingival index or periodontal index. And irreversible index is index that measures conditions that will not change even after doing treatment also. Suppose if a patient is having dental caries in 3/6, so the caries status is, suppose DMFT index is the index to measure dental caries, that is DK missing and filled teeth due to caries. So in that, suppose if patient is having caries in 3/6 means the DMFT is 1. And again, if that patient is going for treatment, filling has been done in 3/6, then again the DMFT score also will come as 1 because dk will become 0, fill will become 1 and missing will become 0. So total adding all the 3 components, it is again 1. So we cannot revert back the score. Depending on the extent of the teeth examined, one is full mouth index, that is all the teeth in the dentition is examined, and simplified index is only specified tooth is measured to record the index. That is called simplified index. And based on the entity it is measured, that is if you are measuring the disease status, then it becomes the disease index. If you are measuring the symptoms for the disease which is present, then it becomes symptom index. Suppose for a gingivitis, the symptoms will be the bleeding. So if you are measuring the bleeding condition, then it becomes symptom index. Treatment index is what treatment has been done or what treatment is required for that individual. If you are measuring with the help of an index, that comes the treatment index. Based on the general categories, index can be defined and classified into simple index and cumulative index. Simple index is when the index measures whether the condition is present or absent. If the index tells whether the condition, suppose plaque index, if you are taking whether plaque is present or absent, it will measure. So that is called a simple index. Cumulative index is it will measure both the past as well as the present condition. That is in the past whether disease has happened and as well as in the present situation whether disease is present or absent. If it tells, it is called cumulative index. Uses of an index is it is used in individual patients, in research and in community health. For individual patients, we can use the indices to recognize or to make the people to understand what oral problem he or she is having. And for example, if we are advising the oral hygiene measures, we can reveal the effectiveness of the oral hygiene practices, what they are performing, whether it is they are performing in a better manner or still improvisation has to be done in the oral hygiene practice. We can show to the patient, and we can also motivate the patient for prevention and for professional care for control and elimination of diseases. In research, by using the values coming from the indices, we can have the baseline data for the factors what we are measuring, and we can measure the effectiveness of any preventive controls or any agents or any treatments we are providing, and we can measure the effectiveness of mechanical plaque control or the professional care which is taken by the patient. In community health, it shows both the prevalence as well as the incidence of the disease condition, and it provides the baseline data for existing dental practices, and it assesses the need of the community, compare the effects of community programs and evaluate the results which has been produced by the programs which is conducted in the community. Thank you.